Welcome back. Just a few minutes ago, I spoke with one of the government's more influential scientific advisors, and I began by asking whether he had a clue yet whether it would be safe to give us back all our freedoms, no more social distancing, no mask wearing and so on the 21st of June.
As you say, it's a complex time, and we're trying to track independently what's happening with the different strains of the virus circulating in the country at the moment. And assess the impact of that step 3, the relaxation on Monday. At the moment, what we can see is in a number of areas, really quite a handful, we're seeing very explosive growth of the Indian variant. In other areas where the variant has been established, though, we're seeing slower growth. So one of the challenges is generalizing. Is the picture we see in Bolton typical, or is it really an outlier? And it will take a few more days, if not a couple of weeks, to really be sure of the answer to that question.
And just to be clear, what is it that we will have to know to decide, when I say we, it's the government, to decide whether or not we can go ahead with the June the 21st release of all restrictions?
Putting strains on one side, if we start to see across a wide area of the country very explosive growth of whatever variant there is, of case numbers overall, then that means the virus can get ahead of our vaccination programme, and no vaccine is perfect, of course. On the other hand, if we see something more in line with our expectations, it will be encouraging that, yes, we can move to step 4. And so that's fundamentally what we're tracking in the next 2 or 3 weeks.
Now, the Prime Minister has been absolutely clear that it is possible that we may still have to wear masks, there may still have to be social distancing on June the 21st. You know, we may not get all our freedoms back. Is there also a risk that we may have to revisit some of the new freedoms, such as eating indoors, for example, in restaurants, that we only got on Monday? Is that possible?
So whether we go forward with relaxation or in some areas, or indeed nationally have to go backwards a little, at least temporarily, will very much depend on the questions we've been discussing on exactly how much more transmissible this new variant is and the extent to which it reduces the effectiveness of vaccines. And we can't be definitive about either of those things at the moment. So, I mean, there are a number of scenarios which are possible, and we're trying to, very urgently pin down which scenario is going to be most likely. And science is never going to be a definitive thing on this timescale. What we're doing is building up evidence gradually over time to allow us to make a more informed decision nationally.
Now, the Prime Minister, the Health Secretary said today that they were doing a study about mixing vaccines for the booster. Is there evidence, however, that for the second jab, actually, it might make sense for those who've had the AstraZeneca jab to have, for example, a Pfizer or a Moderna second boost? What do we know about that?
So a number of studies have just started reporting results of mixing doses between different vaccines, and they look very encouraging so far. A Spanish study reported just in the last 48 hours, and that showed that by mixing doses, after the second dose, you've got a much higher antibody response. So what we know is that the Pfizer and Moderna and AstraZeneca vaccines are very similar in the immune response after the first dose. But after the second dose, people who get Pfizer or Moderna get a higher antibody level than people who get AstraZeneca. So I think it's an entirely feasible strategy to boost immunity through a kind of second Pfizer or Moderna dose. And potentially the other way around. If somebody's got Pfizer first, AstraZeneca is likely to be highly effective at boosting their immunity too.
Just to be clear, do we know anything about, with the current vaccinating approach, whether you are more protected with Pfizer and Moderna than you would be with AstraZeneca? Against the India variant, I'm thinking in particular.
Well, first of all, the data on the extent of protection vaccines give against the India variant is very, very sketchy at the moment. I mean, there is a lot of work being undertaken by many scientists to try and address that question, both in labs, which is not direct, but gives you some indication, and then directly looking at infection rates in people who've got the Indian variant versus the previous Kent variant, which is dominant, and how that relates to vaccination. What we expect from all the data we have, just because the Pfizer and Moderna vaccines at the end of their clinical trials had 95% or so effectiveness at blocking infection and disease, is we'd expect those to be able to be more resistant to variants than maybe other vaccines which had some slightly lower efficacy. But really at the moment, it's an open question. We're trying to collect the data.
And then finally, and this is an issue that you looked at in a different context in the past, do you have any sense of, how much more at risk the UK was put by that fortnight delay in putting India on the red list?
It's not something we've looked at. I mean, there has been a lot of talk about the India variant. Should we have picked it up earlier? I mean, these things are very challenging. And I should say the red list decision was not based on the new variants in India. The red list decision was based on the case numbers in India exceeding a certain threshold. It was actually some weeks later that we got enough data together to be able to conclude that this particular variant, and there are lots of India variants, but this one is called B1.617.2, posed a particular risk. And that actually post-dated the decision to go to the red list. So I'm not going to get involved in the kind of politics of the timing.
No, it's not a sort of politics issue. It is a sort of science issue. Vast numbers of people were coming from India infected. And put even the variant to one side, the argument was it was just imprudent to wait that long.
So, I think we have learned lessons. First of all, I'm not here to defend the policies in place, but we have learned lessons in the last few weeks about the effectiveness of, let's say, home quarantine visitors, which I think is much lower than we might have hoped. That basically, if you're wanting to stop variants coming into the country through border measures, then the only really effective way of doing that is quarantine outside the home. But of course, there's a political and a policy decision about how much you want to trade off stopping variants coming into the country, which you probably can only ever do to some limited extent, and having free movement of people and allowing the travel industry to restart and those things. And so I think the science is becoming clearer, but still effectively it is a policy and political decision.
Well, we're almost out of time. Very quickly, do you agree with Dominic Cummings that more public scrutiny of decisions by government on all this would be a good thing?
I mean, it's been interesting. I think probably with government decisions and processes, yes. The actual scientific work undertaken in this pandemic has actually been generally very public from the outset. I mean, it's been an explosion of people not waiting, sitting on their results and publishing them in journals, but putting them out in real time, as we did in our group and as really all scientific groups in the world have done.
Brilliant. Neil, as always, great to see you. Thank you so much.
Thank you.